Then the other myth, which people come and tell me about arthritis is, I don't think I have any stress. Stress does not cause no influence on the joint. Ladies and gentlemen, let me tell you one thing very important. Even in your work, when you have a lot of stress, etc., you start experiencing back pain, you start experiencing hand pain, you start experiencing leg pain, your sleep is very disturbed, you're irritable, and you also become very, very sensitive. This also happens with doctors, especially in this COVID time. Things are very, very tough, because dealing with human emotions is very, very difficult. Dealing with inanimate objects is very, very easy, but the problem is we have to deal with the boss, etc., who's not inanimate. But here for a doctor, we are dealing with life and death, and that stress gets into our body. So that is what we call, there is a relationship between the body and the mind. The body is called the soma. The mind is called the psyche. So there's a relationship, what we call the mind-body relationship, and people are very stressed and very anxious. They develop pain all over the body, they develop muscle pain, muscle stiffness, they develop pain in the joint, etc. So what we doctors do, holistically we approach the patient and we analyze whether they are very tensed or not, and we ask them to get into some coping up mechanisms, stress management techniques, meditation and yoga. Unfortunately, yoga was born in India, but it is living very well in the West. Unfortunately, people have only have started patronizing yoga in this country. It's very good for the body, it's very good for the mind, and also adopt what the great spiritual masters did: meditation, listening to very soulful music, reading books. You must have some hobbies also in life. All these things are distraction techniques which take away from anxiety and tension, and your arthritis will become much better. Now the other myth is, I have got arthritis, I will not walk. Who told you not to walk? It's a lazy, it's just an excuse for you to be lazy. That's all very important. Arthritic patients can walk. Only if the knee joint is very severely painful, they cannot walk. At that point of time, we ask them to have restricted walking, and then if need be, we even do a joint replacement to them. Myth: arthritic patients should not do any exercise. They should just sit like a robo on the house or stand like a robo on the house, not even move the joint. One important thing: life is mobility and mobility is life. So all arthritic patients should do joint mobilization exercises daily, starting from the head like this, and do the shoulders, and go to the elbows, then come to the wrist, then do this movement daily, then also movement of the fingers. Similarly, what you have to do is to move the hip joints and move the knee joints, move the ankle, and last but not the least, even the joints of the toe. All these maintenance exercises, range of motion exercises should be done at least 15 to 20 minutes once a day at least. And the best one to cause relief of pain is to have a shower in warm water. Fortunately, now water is available in the state very well. So you should have a warm water bath. If the joint is very, very swollen, then you can apply ice. Ice fermentation is extremely good for these patients. And this is something which baffles me when people come and tell me. In fact, I had a very interesting incident in an Apollo hospital. I had a person who's a non-resident Indian who came on a medical tourism to see me for rheumatoid arthritis. So very disturbing that I should be asked that way. He came and asked me, "Doctor, I have rheumatoid arthritis." The first question was, how many patients with rheumatoid arthritis have you seen? I'm basically a very sarcastic person with an element of wisdom in that. I said, you are the first patient with rheumatoid arthritis I'm seeing. And then he said, no, you tell me, how do you treat rheumatoid arthritis? Then I finally told him, if you have come to interview me for a consultant post in Apollo Hospital, I'm already a consultant here. But if you have come for treatment, then you kindly listen to me. What I'm telling you, half knowledge is very, very dangerous. To be very frank, after 35 years, I should accept that I still know very little and don't know a lot. That's very, very important. So after coming to you about the myths about arthritis, the fact that arthritis is a rheumatological problem. Arthritis needs to be seen by a rheumatologist. It is not a neurological problem. It is not an orthopedic problem. It is a myth that it occurs only in women. It can occur both in men and women. It is a myth saying that it occurs only in the elderly age group. It can occur in all age groups ranging from children to adults and the elderly. Regarding diet, no special diet for arthritis except in gout, where people will be asked to avoid high quality non-vegetarian food. The influence of climate, cold weather will cause arthritis. It is a myth. Cold may increase the subjective sensation of increasing joint pain, whereas people forget arthritis both in the Sahara Desert as well as in Switzerland. Cold does not cause much of problems. I have arthritis. The doctor has asked me to do exercises. I will not do exercise. Please exercise the joints, very important. Please follow up your exercise program. Best diet, well balanced, nutritious diet. Food supplements available in the departmental store and Amazon and all that stuff is absolutely not encourageable. Best is fresh fruits, fresh vegetables, and then you have the grandma treatment like turmeric. You can take your spicy food, etc. It doesn't do anything. Some people say that people with arthritis should avoid dairy products. There is a lot of confusion about it. You can consume normally. We are not going to take 2.5 liters of milk daily or probably 1 gram of cheese or anything like that. Whatever suits you, take. Somebody can ask me from the audience, when I take certain foods, my joint pain increases, my joint swelling also increases. Well, some people they say may have an element of food allergy which can cause precipitate arthritis. If anything you find it does not agree with you, precipitates joint pain, I will not say it's psychological. Don't take that food, that's all. Like how we do, we avoid a person whom we don't like. If that food does not agree with you, better avoid the drug. That's very important. Arthritic patients can get married. Very important intellectual honesty of telling the people that, you know, I have an arthritic disease. It will cause psychosocial problems. You have to accept me as a package. And because the important defense for that is nothing prevents from the other partner developing arthritis after they get married. The most important problem in life is uncertainty of certainty. Anybody can develop any problem at any point of time. So we can't get angry with the wife or the husband just because they come to you with arthritis, because you also can fall a prey to the same problem. Be empathetic to patients with rheumatoid, with arthritis. Be very, very empathetic. No sympathy. Be empathetic. Be very, very considerate to them. And other important point is, people with arthritis will come and say, I will lie down this way, I will lie down that way. Very important. You have to meet the physiotherapist as well as the doctor who will ask you to do some modifications at your workstation, even in the office. See, suppose I got rheumatoid arthritis in the hand, then you know you have to use the mouse for a long period of time. We ask them to wear some splints, we ask them to take some rest in between. So what happens is modification of the work environment at the workstation is very, very important when people have arthritis. They can always be given, you know, the leverage of say working for 1 hour and to take rest for 5 to 10 minutes and then get back to work. That's very, very important. Then arthritic patients should never undergo surgery. It is an absolute myth. We have had patients who have had replaced the knee joint, the hip joint, etc. Arthritis, there are no medications available. Wonderful medications are available in this country, and we are at par or even better than the Western world when it comes to the management of arthritis. There are 180 types of arthritis. All the medications which are available abroad are available in the Indian soil today. In fact, the Indian pharma companies, I should definitely bow my head to them. They are made the same generic molecule in an Indian way, and they are equally as effective as their foreign counterparts. Very good medications are available. Last but not the least is, do not get frightened of arthritis. Do not read too much of the internet and become a professor. Allow the doctor to treat you. The last important thing which I would like to tell you is be very, very happy in life. I had written a poem when I was in my 6th standard. The title of this poem is very simple. I am dying. It's very simple to put it across. When I was a child, I was dying every day to excel in school. When I was in college, I was dying every day to excel in academics. When I was at work, I was dying every day to reach the top. When I got married, I was dying every day to settle my family. And now I am dying, I have forgotten how to live. So like the Buddha, live the present. The past is a history, the future is a mystery. Let us enjoy the present and let all of us enjoy this. Now you are with me for about 45 minutes. I definitely am guarantee that most of us you are with me. Enjoy this moment and be happy. We'll now get into questions. Can rheumatoid arthritis be completely cured? I'm extremely sorry, as a rheumatologist with absolute scientific, intellectual honesty and integrity, I should say, rheumatoid arthritis is not completely curable. It is controllable. But one thing given by one, Venkata, what I'd like to tell you is all rheumatoid arthritis patients do not become crippled. It only occurs in a minority of people. Certain patients with rheumatoid have just one phase of rheumatoid and they become all right by themselves. Another group of people have what you call increase in the joint problem, decrease in the joint problem, increase in the joint problem, decrease in the joint problem. These are the group of people who have wonderful medications to treat them. Now I find I must apologize. I did not treat my rheumatoid arthritis patients properly 35 years ago because I didn't have the medications. Now I have wonderful medications. I have had patients with rheumatoid arthritis who have been treated, who are running the marathon, who are participating in races, who are participating in sports. So very effective medications there, don't get worried.